Good evening, and it's great to have you with us here on this Tuesday night as we mark that grim milestone tonight. The deadliest 24 hours yet, New York alone with 731 deaths in a single day. New Jersey with very difficult numbers as well tonight. In fact, President Trump a short time ago saying, "We send our love to the great people of New York and New Jersey," calling them tough, strong, and brave, as I mentioned. He also talked about African Americans in this country and the terrible toll from this virus. Tonight, we look into that as well, what Dr. Anthony Fauci just said about this. Of course, the other hotspots tonight, Michigan, Louisiana, and Florida, and the number of deaths in the U.S., more than 12,000, 2,000 more than we reported last night as we came on the air. New York's hospitals facing very difficult decisions. Maimonides Medical Center in Brooklyn giving ABC News a tour of their ICU. One doctor putting it bluntly, saying this is a mass casualty event, adding, "It's like war." The need for beds still growing. The Navy hospital ship Comfort now taking COVID-19 patients. St. John the Divine Cathedral will become New York City's newest field hospital. Michigan is now seeing the third highest number of deaths in the country. One hospital system reporting 1,500 staff are showing symptoms. Louisiana tonight, one parish alone with a death rate more than double the rate of New York City's. And again this evening, we have news on the British Prime Minister Boris Johnson in intensive care, now being given oxygen. News from the Queen and from 10 Downing Street tonight. But we're going to begin here in this country. The president saying moments ago, this is a monster we're fighting. He thanked Americans for following the guidelines to stay home, saying everyone has a role to play. And so we begin with ABC's Tom Yamas here in New York.
Tonight, more evidence the battle against coronavirus is far from over. New York dealing with its highest single-day spike in deaths. 731 lives lost to COVID-19.
That's 731 people who we lost. Behind every one of those numbers is an individual, is a family, is a mother, is a father, is a sister, is a brother.
The city alone losing more than 4,000 people. That's more than perished in the World Trade Center attack. But tonight, the governor pointing to a sign of hope. The rates of hospitalizations are going down.
You see that plateauing. That's because of what we are doing. If we don't do what we are doing, that is a much different curve.
But inside hospitals, doctors and nurses are still suiting up for a war. Maimonides Hospital in Brooklyn taking us into their ICU.
Let's go.
We're right there as Dr. William Pascal is alerted there is a patient in desperate need of help. As Dr. Pascal rushes, warning alarms on medical equipment are going off. A nurse telling us what's happening. A patient is having extreme trouble breathing. They need to flip her onto her stomach.
And help them secrete the mucus better.
This is the moment doctors face around the clock. Life or death in the hands of this medical team. Within minutes, Dr. Pascal comes out. They've stabilized the patient. He tells us what just happened.
What happened just now is an absolute emergency. It's a life or death situation. Unfortunately, that's what we're seeing with a lot of our patients here. It's, we run around this unit many times just putting out fires.
With hospitals still pushed to the brink, new spaces are still opening. The naval hospital ship, the Comfort, will be taking up to 500 COVID-19 patients. And now, the country's largest Gothic cathedral, St. John the Divine, to be converted during this Holy Week into a field hospital. Tents to be set up beneath the nave and in the crypt below. A drastic step, but doctors telling us so much of this virus is shocking.
I just took like a bird's eye view of the ER and saw all the people struggling to breathe and all the monitors with low oxygen. And I broke down and cried. It's been like a bad dream.
Lawrence and Christine Haynes are both emergency room doctors, sending their young son and daughter away so they could tend to the ill.
Just knowing that every day we are hopefully making a difference and, saving lives and showing up and being where we need to be, I think that's enough motivation to get through.
And tonight, new numbers in New York reveal 61% of those killed were men. 63% were age 70 or over. 86% had underlying conditions like high blood pressure and diabetes, heart disease, and dementia.
There's a monster we're fighting, but signs are that our strategy is totally working.
All of this as funeral homes in New York are struggling to keep up to lay victims to rest with dignity.
We're trying to make it easier for the families, but again, it's hard. It's a very hard situation right now.
Experts warning the peak in many places is still days away. Michigan running out of PPE extending their state of emergency into July. Those shortages coming on the heels of a new report from the Health and Human Services Inspector General, revealing more than 300 hospitals were concerned 2 weeks ago about delays in lab results and not having enough staff to run ventilators if they got them. In Louisiana, one parish has seen death rates at more than double the rate of New York City. But now the state is getting more of those critical ventilators.
Just because we think we're starting to flatten the curve doesn't mean our job is over. And in fact, now is the time to double down.
Ventilators are so important for patients like Paul Logan, a 57-year-old athletic director from Indianapolis. The father of 4 is now fighting for his life on a breathing machine. His family asking for prayers, his students rallying around their coach.
We are praying for a speedy recovery, as we know every single Panther is resilient.
No one wanted us to succeed more than you did, and we're really thinking about you and your family. Stay strong.
Our thoughts and prayers are with you and your family. We hope you recover soon.
All of them sending a message tonight. Tom Yamas with us tonight outside St. John the Divine Cathedral, the site of that planned field hospital in the coming days. And Tom, as we cover this outbreak in the middle of this storm, there are also new questions tonight about what the federal government knew and when they knew it, whether they did enough to prepare Americans for this.
David, our reporting team down in Washington has confirmed that trade advisor Peter Navarro sent 2 memos to the White House in January and in February warning that millions of Americans could die of the coronavirus and it could cost the economy trillions of dollars. Tonight, the president was asked about this. He says he didn't know about the memos, he didn't read them, and he doesn't know if it would have changed anything. He's defending his response, even though critics say the president did restrict travel to China. For weeks afterwards, he did downplay the severity of this disease. David?
All right, Tom Yamas with reaction from Washington. And I should note that ambulance that went behind Tom, that is such a common sight these days here in New York City. There are ambulances everywhere you look. Tom, our thanks to you again tonight.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.